Serotonin, melatonin, and niacin are synthesized from what precursor? A. L-tryptophan. B. N-acetylcholine. C. The answer is A. L-tryptophan. Serotonin, melatonin, and niacin are all synthesized from L-tryptophan, an amino acid prevalent in many foods including chocolate, oats, dates, milk, sesame seeds, eggs, meat, and cheese. L-tyrosine is involved in the synthesis of dopamine. Acetylcholine is the neurotransmitter released at the neuromuscular junction, which stimulates contraction of skeletal muscle. Taurine has many biological functions in the cardiovascular, muscular, and nervous systems, as well as others.
Which of the following symptoms would be most likely to present in a patient with a biotin deficiency? A. Thyroiditis. B. Alopecia. C. Nausea. D. Edema. The answer is B. Alopecia. Biotin, or vitamin B7, plays an important role in the health of the hair, nails, and skin. Deficiency generally manifests as alopecia, loss of hair color, brittle nails, and dermatitis. Nutritional intervention may include all of the following except dash. A. Admonishing patients for dietary indiscretion. B. Diet prescription or recommendation. C. Providing specific nutrient supplementation. D. Initiating tube feeding. The answer is A. Admonishing patients for dietary indiscretion. Offering a treatment plan that includes specific nutrient supplementation and a dietary protocol is a normal part of a nutritional counseling and intervention. Initiating tube feeding is only necessary in cases of anorexia or other forms of malnourishment, but is still within normal procedures. Admonishing patients for their dietary choices, however, would be counterproductive to the nurse's attempt to foster trust and willingness on the part of the patient, and so would be inappropriate in an intervention setting. Which of the following conditions is caused by chronic protein deficiency? A. Pellagra. B. Kwashiorkor. C. Marasmus. D. Beriberi. The answer is B. Kwashiorkor. Kwashiorkor is a condition of sufficient caloric intake with severe protein malnutrition, often seen in impoverished areas where individuals must survive on carbohydrate-based sources of nutrition. This results in a severe deficiency of albumin, with symptoms such as edema, ascites, fatty liver, and dermal ulceration. Marasmus is a condition not specifically of protein deficiency but of general starvation, which may be due to lack of food security or to intentional fasting or extreme caloric restriction. Pellagra is a condition caused by niacin deficiency, and beriberi is a thiamine deficiency syndrome with neurological, gastrointestinal, and cardiac manifestations. Which of the following nutrients can cause hypercalcification in soft tissues when consumed in excess for prolonged periods? A. Magnesium. B. Potassium. C. Niacin. D. Vitamin D. The answer is D. Vitamin D. Hypervitaminosis D, or vitamin D toxicity, has been known to cause calcification in soft tissues due to vitamin D's role in calcium absorption and metabolism. None of the other nutrients are as closely related to calcium metabolism, and do not cause hypercalcification in soft tissues when overconsumed. Methylene tetrahydroflate reductase, MTHFR, deficiency results in the inability to perform which of the following metabolic processes? A. Methylation of folate. B. Homocysteine remethylation. C. Methylation of vitamin B12. D. All of these. The answer is D. All of these. Methylene tetrahydroflate reductase, MTHFR, is an enzyme with multiple important metabolic roles, including the methylation of folate, vitamin B12, and homocysteine. MTHFR deletions can result in folate and B12-related anemias and high homocysteine due to interruption of homocysteine recycling into methionine. Which of the following is an essential amino acid? A. Glutamate. B. Cysteine. C. Alanine. D. Tryptophan. The answer is D. Tryptophan. Essential amino acids are amino acids that cannot be synthesized within the body, but must be consumed through the diet. Tryptophan is the only essential amino acid listed. In all, there are 9 essential amino acids. All of the following criteria must be taken into account when establishing daily reference intakes, DRIs, except dash. A. ULs, upper intake levels. B. EAR, estimated average requirements. C. ADI, active daily intake. D. RDA, recommended daily allowance. The answer is C. ADI, active daily intake. All of the criteria listed and AI, adequate intake, not listed, must be taken into account when establishing a daily reference intake, DRI, except for ADI, active daily intake, which is a fictitious criteria. Which of the following is the most abundant mineral in the human body? A. Calcium. B. Magnesium. C. Iron. D. Potassium. The answer is A. Calcium. The most abundant mineral in the human body is calcium. It is primarily stored in the bones and the teeth, and makes up half of the total weight of the skeleton. In addition, calcium is present in nerves, muscle cells, blood, kidneys, and various other soft tissues of the body. What is the formula for calculating body mass index, BMI? A. Weight, in pounds, divided by square of height, in inch. B. Square of height, in inch, divided by weight, in pounds. C. Square of height, in meter, divided by weight, in kg. D. Weight, in kg, divided by square of height, in meter. The answer is D. Weight, in kg, divided by square of height, in meter. In standard units, the formula for body mass index is weight, in pounds, divided by square of height, in inch, the whole multiplied by 703. Which of the following is considered a normal body mass index, BMI? A. 18.5 to 24.9. B. 22.9 to 30.5. C. 16.9 to 22.9. D. 26.5 to 32.9. The answer is A. 18.5 to 24.9. Normal BMI is considered to be 18.5 to 24.9. A BMI below that would indicate that the individual is underweight, while a higher value may indicate that the individual is overweight. The answer is A. 40. BMI values between 30 and 39.9 indicate obesity, while a BMI over 40 could indicate that the individual is severely obese. A BMI over what value could indicate severe obesity? A. 40. B. 38. C. 36. D. 34. Which of the following is a water-soluble vitamin? A. Vitamin B5. B. Vitamin D. C. Vitamin E. D. Vitamin A. The answer is A. Vitamin B5. Vitamin B5, or pantothenic acid, is the only water-soluble vitamin listed. Vitamins A, E, D, and K are all fat-soluble and so should be consumed with fat to be absorbed. Which of the following nutrients delays gastric emptying, increases satiety, and lowers LDL cholesterol by interfering with the absorption of dietary cholesterol? A. Unsaturated fat. B. Soluble fiber. C. Carbohydrates. D. Insoluble fiber. The answer is B. Soluble fiber. Soluble fiber, present in oat bran, barley, nuts, seeds, and legumes, delays gastric emptying, increases satiety, and lowers LDL cholesterol by interfering with the absorption of dietary cholesterol. Insoluble fiber passes through the gastrointestinal tract relatively intact, provides bulk for stool, and reduces bowel transit time. Carbohydrates and unsaturated will not lower LDL cholesterol or delay gastric emptying, though they will increase satiety. Which of the following vitamins will be better absorbed when taken with a meal that contains fat? A. Vitamin D. B. Vitamin B2. C. Vitamin C. D. Vitamin B6. The answer is A. Vitamin D. Vitamin D is a fat-soluble vitamin, and so will be better absorbed when taken with a meal that contains fat. The other vitamins listed may be better absorbed with food, but do not require fat for transport across intestinal membranes, as they are water-soluble. Which of the following is a conditionally essential amino acid? A. Arginine. B. Aspartic acid. C. Methionine. D. Histidine. The answer is A. Arginine. Conditionally essential amino acids are those that can be produced by the body under normal circumstances, but may not be able to be produced during certain situations, such as certain disease states or severe catabolic stress. Arginine is the only conditionally essential amino acid listed. Histidine and methionine are both essential amino acids, while aspartic acid is a non-essential amino acid. Which of the following nutrients has strong antioxidant properties? A. Potassium. B. Biotin. C. Copper. D. Vitamin C. The answer is D. Vitamin C. Vitamin C is one of the body's most important antioxidants. Antioxidants are reducing agents, that is, they themselves get oxidized. Recall, oil rig. Thus antioxidants such as vitamin C are electron donors, able to stabilize the free radicals produced by various metabolic processes in tissues and extracellular spaces. Vitamin E, not listed, is another important antioxidant and is actually more potent than vitamin C. Which of the following substances, produced in the stomach, aids in later absorption of vitamin B12 in the small intestine? A. Hydrochloric acid. B. Intrinsic factor. C. Pepsin. D. Gastric lipase. The answer is B. Intrinsic factor. While all of the substances listed are present in gastric secretions and are necessary for normal digestion, intrinsic factor is the only one that has a direct role in vitamin B12 absorption in the small intestine. Deficiencies in intrinsic factor due to genetic variation or damage to stomach lining can result in pernicious anemia, a type of anemia that is caused by insufficient levels of B12. What enzyme, present in saliva, initiates the digestion of carbohydrates? A. Lipase. B. Protease. C. Pepsin. D. Amylase. The answer is D. Amylase. The digestion of dietary carbohydrates is initiated by amylase, an enzyme present in saliva. This enzyme breaks down long carbohydrate molecules into shorter units such as disaccharides. Lipase breaks down fats and is not present in the saliva, rather it is secreted by the pancreas into the duodenum. Pepsin is a protease, an enzyme that breaks down proteins. This enzyme is secreted by the chief cells of the stomach in its zymogen form, pepsinogen. It is activated by the product of the parietal cells, hydrochloric acid. Note that amylase is also secreted by the pancreas to complete the chemical digestion of carbohydrates into monosaccharides so that they can be absorbed by the brush border of the small intestine. What organ produces the bile necessary for digestion of lipids? A. The stomach. B. The liver. C. The duodenum. D. The gallbladder. The answer is B. The liver. Bile is produced exclusively in the liver. It may then be stored in the gallbladder so that it can be released during digestion of a fatty meal. No bile is produced in the stomach, nor the duodenum. The vast majority of bile is cholesterol derivatives that stick to dietary fiber and are excreted along with the fiber. Thus increasing fiber is, mainly soluble, is an effective way to decrease cholesterol. Which of the following is a necessary cofactor for the production of collagen? A. Thiamine. B. Vitamin D. C. Selenium. D. Manganese. The answer is D. Manganese. Manganese, found in oats, brown rice, chickpeas, and spinach, is a cofactor for the enzymes that produce the amino acid proline. Proline is essential for collagen shape and integrity, and is an amino acid, not a cofactor. Other important minerals required for collagen production include copper, zinc, vitamin C, and iron. Which age group has the highest risk for physiological changes due to malnutrition? A. Over 72. B. 12 to 24. C. Over 60. D. 1 to 18. The answer is D. 1 to 18. Children ages 1 to 18 are at the highest risk for physiological changes due to malnutrition. Significant nutritional deficiencies at this age can cause failure to thrive, stunted growth, long-term brain damage, and increased incidence of cardiovascular and metabolic disease later in life. Which of the following minerals must be supplemented in a patient who is on a long-term laxative prescription? A. Calcium and potassium. B. Manganese and selenium. C. Magnesium and chromium. D. Zinc and copper. The answer is A. Calcium and potassium. Prolonged laxative use can lead to hypokalemia and hypocalcemia. This is due to alterations in gastrointestinal absorption and excretion of potassium and calcium. Magnesium can also be depleted during long-term laxative use, but chromium is unlikely to be affected. Zinc, copper, manganese, and selenium are also not generally impacted by normal laxative use. Which of the following foods is highest in vitamin K? A. Sweet potatoes. B. Dark leafy greens. C. Pumpkin. D. Beets. The answer is B. Dark leafy greens. Dark leafy greens such as kale, collard greens, and chard have among the highest levels of vitamin K of any food. The other foods listed, beets, sweet potatoes, and pumpkin all have very low vitamin K content, and are safe for a patient on a warfarin diet. Which of the following foods would be unsafe to consume for a patient taking atorvastatin? A. Orange juice. B. Fish. C. Grapefruit. D. Dark leafy greens. The answer is C. Grapefruit. Grapefruit can decrease the activity of cytochrome P450, one of the body's most important detoxification pathways, by as much as 30%. Consumption of grapefruit while on certain medications, including atorvastatin, can lead to toxic levels of the drug. All other foods listed are safe for patients to consume while taking atorvastatin. Which of the following foods should be avoided in patients who are taking a potassium-sparing diuretic, such as amiloride? A. Tree nuts. B. Alcohol. C. Orange juice. D. Red meat. The answer is C. Orange juice. Patients who are taking potassium-sparing diuretics must be counseled to eat a diet low in potassium. This is due to the fact that consumption of potassium-rich foods, such as orange juice, can lead to dangerously high potassium levels. Excess potassium levels can cause heart arrhythmia and sudden cardiac death. A low potassium diet would be recommended for a patient with which of the following conditions? A. Kidney failure. B. Liver failure. C. Gallstones. D. Diabetic neuropathy. The answer is A. Kidney failure. The kidney is the main route of potassium excretion in the body. During kidney failure, the kidneys are unable to remove excess potassium from the blood. This can lead to hyperkalemia, which can cause nausea, weakness, numbness, arrhythmia, and cardiac arrest.
Allicin, a compound with antibacterial, anti-inflammatory, and antithrombotic properties, is found in which of the following foods? A. Garlic. B. Cold water fish. C. Broccoli. D. Cocoa. The answer is A. Garlic. Allicin is found primarily in garlic, and has a variety of properties that are beneficial to the health. It is antimicrobial, anti-inflammatory, antithrombotic, it can reduce atherosclerosis, decrease blood pressure, and act as a mild antioxidant.
Which of the following is the best source of omega-3 fatty acids? A. Grapeseed oil. B. Wheat germ oil. C. Ground flax seeds. D. Shrimp. The answer is C. Ground flax seeds. Half an ounce of ground flax seeds provides over 130% of the dietary reference intake, DRI, of omega-3 fatty acids. An equivalent serving of shrimp is able to provide 15% of the DRI. Wheat germ oil and grapeseed oil are both good sources of omega-6 fatty acids but are not significant sources of omega-3 fatty acids. Which of the following is thought to reduce pain by depletion of substance P when applied topically? A. Purandin. B. Polypeptide P. C. Capsaicin. D. Curcumin. The answer is C. Capsaicin. Capsaicin, found in cayenne peppers and other species of plants in the genus Capsicum, is used in topical analgesic creams to reduce joint and muscular pain. It is thought to work by depletion of substance P in the sensory nerves. What three parts does the brainstem consist of? A. Pons, cerebellum, medulla. B. Corpus callosum, medulla, and cerebellum. C. Medulla, pons, and midbrain. D. Midbrain, cerebellum, pons. The answer is C. Medulla, pons, and midbrain. The brainstem consists of the medulla, the pons, and the midbrain. The cerebellum is an outgrowth posterior to the pons. The corpus callosum is the broad bundle of neural fibers that attaches the left hemisphere of the brain to the right hemisphere. Olfaction is what form of sensory reception? A. Chemoreception. B. Thermoreception. C. Mechanoreception. D. Baroreception. The answer is A. Chemoreception. Olfaction is form of chemoreception, or a translation of a chemical signal into an action potential. Smells are triggered by molecules of volatile chemicals that trigger chemoreceptors in the epithelium of the olfactory cleft. Olfactory nerves travel through what structure in order to enter the skull? A. The cristagalli. B. The cribriform plate. C. The ethmoidal labyrinth. D. The perpendicular plate of the ethmoid. The answer is B. The cribriform plate. The olfactory nerves travel through the cribriform plate of the ethmoid bone. The grooves of the cribriform plate support the olfactory bulb, and the bone is perforated by many tiny foramen for transmission of the olfactory nerves from the epithelium of the nasal cavity to the olfactory bulb. The other structures listed are all bony features of the ethmoid bone, but they do not allow the passage of olfactory nerves. Approximately how many action potentials must be triggered in an olfactory receptor neuron in order for a smell to be detected? A. 40 to 50. B. 1. C. 200 to 250. D. 80 to 100. E. 2 to 5. The answer is A. 40 to 50. Olfactory receptor neurons require 7 to 8 molecules of a volatile odorant to trigger an action potential, and approximately 40 action potentials must be triggered in an olfactory receptor neuron in order for a smell to be detected. What type of cell is embedded in the olfactory epithelium? A. Olfactory sensory neurons. B. Supporting cells. C. Basal cells. D. All of these. The answer is D. All of these. There are 3 types of cells embedded in the olfactory epithelium: basal cells, supporting cells, and olfactory sensory neurons. All 3 of these cells play a significant role in the sense of smell, though the olfactory sensory neurons are the only cell type that actually respond to chemical stimuli. All of the following parts of the brain are involved in olfactory sense and recognition except which of the following? A. The insula. B. The arcuate nucleus. C. The piriform complex. D. The orbitofrontal cortex. The answer is D. The arcuate nucleus. The olfactory perception is managed by several parts of the brain, the primary areas being the piriform cortex, the insula, and the orbitofrontal cortex. Other lesser involved areas of the brain include the anterior olfactory nucleus, the amygdala, the entorhinal cortex, and the olfactory tubercle. The arcuate nucleus is an area of the hypothalamus that is involved in regulation of hunger and satiety. Where is the olfactory epithelium is located? A. The eustachian tube. B. The inferior turbinate. C. The sphenoid sinus. D. The roof of the nasal cavity. The answer is D. The roof of the nasal cavity. The olfactory epithelium is located at the roof of the nasal cavity in a relatively large area that includes the superior turbinate and the superior portion of the nasal septum. There are no specialized olfactory cells on the inferior turbinates, and no olfactory receptors in either the sphenoid sinus of the eustachian tube. Which of the following tastes has the lowest detection threshold? A. Sour. B. Sweet. C. Salty. D. Bitter. The answer is D. Bitter. The human tongue can detect bitter flavors at concentrations as low as 8 micromolars per liter. In comparison, in the average person the detection threshold for sucrose is 10 millimoles per liter. The reason for the extreme sensitivity of the human tongue to bitter flavors may be protective, as many poisonous or toxic substances have a bitter taste. All taste buds of the tongue are located in what structures? A. In the palatoglossal arch. B. In the apex. C. In the terminal sulcus. D. In the papillae. The answer is D. In the papillae. Taste buds are located in the papillae of the tongue, a group of structures lining the surface of the tongue from the apex to the base. These papillae are also present in the cheek, the soft palate, the epiglottis, and the upper esophagus. They are not present in the palatoglossal arch. Of the 4 types of lingual papillae, which is the only type that does not contain taste buds? A. Filiform papillae. B. Foliate papillae. C. Circumvallate papillae. D. Fungiform papillae. The answer is A. Filiform papillae. Filiform papillae, the most numerous of the lingual papillae, is the only type that does not contain taste buds. Rather, they serve to move food toward the esophagus, cleanse the interior of the mouth, and spread saliva onto food and mucous membranes. Which of the following cranial nerves is not involved in the sensation of taste? A. The vagus nerve, cranial nerve 10. B. The trigeminal nerve, cranial nerve 5. C. The glossopharyngeal nerve, cranial nerve 9. D. The facial nerve, cranial nerve 7. The answer is B. The trigeminal nerve, cranial nerve 5. The sensation of taste is carried to the brainstem by 3 cranial nerves: the facial nerve, CN7, the glossopharyngeal nerve, CN9, and the vagus nerve, CN10. The facial and glossopharyngeal nerves both communicate sensation from the tongue, while the vagus nerve transmits sensory information from the epiglottis. The trigeminal nerve, CN5, is not directly involved in the sensation of taste, though there is evidence that it is involved in the senses of heat and coolness experienced while eating spicy or minty foods. In addition to the tongue, epiglottis, and pharynx, taste receptors are located in which of the following organs? A. The testicle. B. The pancreas. C. The lung. D. All of these are correct. The answer is D. All of these are correct. In addition to the taste receptors in the mouth and pharynx, taste receptors are located in many other areas of the body. These including the lung, which has taste receptors for bitter flavors, possibly as a mechanism to protect against airborne toxins, the pancreas, the small intestine, the stomach, the brain, and the testis. While the function of taste receptors in the testes is not well known, some research indicates that testicular taste receptors may play an important role in male fertility. Which of the following tastes is not associated with a G protein-coupled receptor? A. Bitter. B. Salty. C. Umami. D. Sweet. The answer is B. Salty. Sweet, umami, and bitter taste are all correlated with receptors for guanine nucleotide binding proteins, also known as G proteins. Taste bud receptors that transmit information about saltiness are triggered by sodium ion channels in the cell wall. Which of the following is not a form of lingual papillae? A. Stratified. B. Foliate. C. Circumvallate. D. Fungiform. The answer is A. Stratified. The 4 types of lingual papillae are fungiform, mushroom-shaped, filiform, thread-like, circumvallate, and foliate. Filiform papillae are the most numerous, covering the majority of the anterior 2/3 of the tongue. Fungiform papillae are scattered along the surface of the tongue, but are more concentrated on the tip and sides of the tongue. Foliate papillae are located on the sides and back of the tongue, and circumvallate papillae are the large, round papillae visible in a row on the posterior aspect of the tongue, just anterior to the foramen cecum and sulcus terminalis. Which of the following triggers sour taste receptors in taste buds? A. Sodium ions. B. Glutamate. C. Hydrogen ions. D. Gustdusen. The answer is C. Hydrogen ions. Sour flavor taste bud receptors are triggered in the presence of hydrogen ions, thus acidic foods often have a sour taste. Sodium triggers receptors for salty flavor, while glutamate and gustdusen, a guanine nucleotide binding protein, or G protein, are associated with umami, sweet, and bitter flavors. Which of the following is the most superior vertebra of the spine? A. The atlas. B. The dens. C. The axis. D. The coccyx. The answer is A. The atlas. The most superior vertebra of the spine is the atlas, or C1. This bone sits on the axis, or C2, over a bony process called the dens. The coccyx, or tailbone, is part of the sacrum. How many cervical vertebrae are in the human spine? A. 5. B. 6. C. 7. D. 12. The answer is C. 7. There are 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. The mnemonic for this is breakfast at 7, lunch at 12, dinner at 5. What bone forms the most posterior and inferior part of the skull? A. The ethmoid bone. B. The maxilla. C. The occiput. D. The sphenoid bone. The answer is C. The occiput. The occiput is the inferior and posterior bone of the skull. It wraps under the bottom of the skull and forms the base on which the head articulates with the spine. The ethmoid bone and sphenoid bone are housed primarily within the skull, and the maxilla forms the upper jaw and part of the orbit. What is the name for the bony protuberances at which the occipital bone articulates with the atlas? C1. A. The onion. B. The external occipital protuberance. C. The external occipital crest. D. The occipital condyles. The answer is D. The occipital condyles. The bony protuberances at which the occipital bone articulates with the atlas, C1, are the occipital condyles. The external occipital protuberance, external occipital crest, and onion are all part of the occipital bone and serve as the attachment points for various muscles and ligaments. What suture joins the frontal bone to the parietal bones? A. The parietal suture. B. The coronal suture. C. The frontal suture. D. The sagittal suture. The answer is B. The coronal suture. The suture that joins the frontal bone to the parietal bones is the coronal suture. The sagittal suture joins the two parietal bones together along the sagittal plane of the skull. There are no sutures named after the frontal or parietal bones themselves.